Dr. Charlton, thanks for joining me today. I wanted to talk with you about a presentation you gave at the International Liver Transplantation Society's annual Congress on the current outcomes of liver transplant recipients long term. Yeah. Tell me a little bit about the key findings of that research.
There's multiple phases of getting through a liver transplantation. There's surviving the surgery, there's the immediate post-operative period where you're trying to heal your wounds, not have rejection, and then there's the next 5-10 years plus. And in those different periods, there's different things that can crop up and affect the patient. So we're going to focus on the longer term things, so things like heart disease, metabolic things like hypertension, lipid trouble, kidney failure, cancer prevention, really trying to give providers sort of a roadmap for getting the best outcomes in the liver transplant recipients.
Okay, and in looking at it from a provider's perspective, what are some of the key takeaways for those physicians and caregivers who are treating people through a liver transplant and post-transplant?
That's a great question. There's really one major takeaway, and that's to use the least immunosuppression or drugs to prevent rejection that you need to keep your patients transplanted organ healthy and avoid these other complications, which many of them are made worse by immunosuppression. So finding just enough immunosuppression, that would be the most important takeaway.
For patients who have that liver transplant or are approaching that, what are the key takeaways of the study for them as a patient?
As a patient, I think stay engaged and make sure that you don't miss your appointments, that you do things like keep an eye on your blood pressure, that you eat well. It's very hard to maintain a healthy weight because the medications can slow your metabolic rate down, but you can absolutely control the composition of what you eat. You can exercise. So I think many of the things that keep you healthy outside of the transplant experience are even more important in the transplant period.
From a patient perspective, what does less immunosuppression mean for them?
Well, two things. So there's three main types of drugs to prevent rejection that we use that we call immunosuppression agents. Many patients are just on one if they get, say, 2, 3, 4 years out from transplantation. So what this means is you'll be taking less types of medication and you'll be taking less doses of those medications.
Okay. Thanks for taking a few minutes to talk with us about this presentation among the others that you're giving here at the conference, and look forward to the other presentations and research you'll be giving.
Thank you. It's a pleasure.
Thanks.